All right, let's get right into it. The gram stain. It's probably one of the first things you learned in micro, right? It's fundamental. But here's the thing. It's incredibly easy to mess up, and a small mistake can have some pretty big consequences. So today, we're going to walk through the 5 most common slip-ups that can throw off a gram stain, and, most importantly, how to fix them.
So, let's say you're in the lab. You run a gram stain. You look under the scope, and everything's coming up pink. Your result says gram negative. But what if the reality is the bacteria are actually gram positive? How in the world does that happen? And believe me, this isn't just some textbook hypothetical. It's a super common problem, and it's exactly why being precise with this technique is non-negotiable.
Okay, so before we can really dig into the mistakes, we've got to make sure we're all on the same page with the science. Let's do a quick 101 on what the gram stain is actually doing down at the cellular level.
Really, when you think about it, the gram stain is kind of like the first big sorting hat for bacteria. It's what we call a differential stain. That just means it uses the physical and chemical makeup of a bacterium's cell wall to split them into 2 main teams, gram-positive and gram-negative.
And this right here, this is the whole game. The key difference is all in that cell wall. Gram-positive bacteria, they have this really thick, dense layer of something called peptidoglycan. You can almost think of it like a big, thick wool coat. It just soaks up that first purple dye, the crystal violet, and holds on tight. Now, gram-negatives, on the other hand, have a much, much thinner layer. It's more like a t-shirt. It can't hold on to that purple dye when you try to wash it out, and that single difference, that's everything.
Which brings us perfectly to our first, and honestly, probably the most frequent type of error. It all happens in the decolorization step. You know, when you use the alcohol or acetone. This is where most stains go wrong, and it is all about timing.
Yeah, you can really see here how it's 2 sides of the exact same coin. Too much time with that decolorizer, you get a false gram negative. Too little time, you get a false gram positive. Let's really break down what's happening in both of these screw-ups.
So, mistake number 1, over-decolorization. This is when you leave that alcohol wash on for just a couple of seconds too long. What happens? Well, that solvent is so powerful, it literally strips the purple crystal violet dye right out of those thick, gram-positive cell walls. So then, when you come in with the pink counterstain, they soak it right up and, boom, they look pink. They're masquerading as gram-negatives.
And then, on the flip side, you've got under-decolorization. This is what happens when that alcohol step is just too short. It doesn't get enough time to wash that initial purple dye out of the thin-walled gram-negatives. So they hang on to that primary stain, they never get a chance to pick up the pink, and they end up looking purple, pretending to be gram-positives. And this is a really, really easy mistake to make if your smear is too thick.
And that's a perfect lead-in to our next big topic. Because you know what? Some errors happen before you even uncap a single bottle of stain. A flawless staining procedure just can't rescue a badly prepared smear. You've got to start with a solid foundation.
All right, mistake number 3. This is one people sometimes forget about. The age of your bacterial culture. Yeah, it might not seem like a big deal, but for accurate staining, bacteria have a shelf life, especially the gram-positives. Over time, their cell walls just start to, well, fall apart.
And here's the magic number you need to remember. Anything over 24 hours can be a problem. For gram-positive bacteria, once you get past the 24-hour mark, their cell walls can start to break down. When that happens, they lose their ability to hang on to that crystal violet dye, no matter how perfect your technique is. They might show up as pink, or even a weird mix of pink and purple, what we call gram variable. It just leads to a totally confusing and unreliable result.
Next up, a mistake we just hinted at, making your smear way, way too thick. I mean, the whole goal here is to get a nice, thin, even layer of cells on that slide. It should look almost see-through before you even begin staining. You know, a thick smear just causes a total cascade of problems. First off, the stain literally can't get to all the cells buried in the middle. Then, the decolorizer can't reach them either, so you get these clumps of under-decolorized bacteria. And maybe worst of all, the cells are all piled on top of each other, so you can't even see their real shape. It's just a recipe for a messy, unreadable slide.
Okay, our last big technical mistake happens during a step that's supposed to help, heat fixation. The idea is to gently stick the bacteria to the slide so they don't wash off. But there's a very, very fine line between fixing and frying. And that brings us to mistake number 5, getting a little too happy with the flame. If you overheat that slide, you can literally cook the bacteria and damage or even rupture their cell walls. And for a gram-positive organism, that damage means its wall can't hold on to the crystal violet anymore.
The result, once again, it shows up as a false gram-negative.
So, we've gone through all the hows of messing up a gram stain. But now, let's talk about the why. Why are we so obsessed with getting this 100-year-old technique right? Well, it's because these results, they have a direct impact on real people, on patients.
So let's do a super quick review. Our 5 big pitfalls are 1. Over-decolorizing. 2. Under-decolorizing. 3. Using cultures that are too old. 4. Making your smears too thick. And 5. Going overboard with the heat fixing. Any one of these can send you down the completely wrong path.
And this is the slide that puts it all into perspective. In a hospital or a clinic, that gram stain result is often the very first solid piece of information a doctor has about what's causing an infection. It helps them make a smart, educated guess about what bug they're fighting and which initial antibiotic to use. Getting it right can give a patient a huge head start on getting better. It really makes you stop and think, doesn't it? In the lab, it's just a shade of pink or a shade of purple. But that simple color difference can change, well, everything. It can change a diagnosis, it can change a treatment plan, it can change a patient's outcome. So what's the real cost of one tiny mistake? It's not just about rerunning a test. It could be a delay in getting someone the right care when they need it most.